Hi, this is Dr. Kolodenker. I'll go over a brief description of where a Cartiva implant in, the procedure for the surgery. So this is the incision line, typically removing redundant skin. Once the hypertrophied bone has been removed, joint is prepped, the sizer is placed. This is the drilling tool that will be used to place the Cartiva implant. Pearl here is do not drill too deep, and be careful of the skin as to not damage it. Sometimes the incision line does need to be longer in order to protect the skin edges. Make sure to copiously irrigate after. That way there are no little bone shards left within the joint. So after this is removed, the joint is irrigated. This is a great implant for patients with big toe joint arthritis, hallux limitus. Here's what you can see what it looks like. That will be where the implant goes. And this is the placement of the Cartiva implant within that space. And give it a good snug hold against a joint and it just comes out. Holding it against the body tends to help. There you can see the implant. We'll get a closer look. See how much joint space is left over. And another great look. For surgical consultations, feel free to call our office. The link is on the bottom. Have a great day.